Another special subset of pneumonia that we often encounter in the hospital includes aspiration pneumonia. Aspiration pneumonia is a type of lung infection that is due to relatively large amounts of material from the stomach or the mouth entering the lungs. So this occurs typically when patients vomit, have a poor ability to control their secretions, and have altered mental status. Signs and symptoms include fever and cough that are relatively quick to start. So this occurs because even prior to the development of an actual pneumonia, which is bacterial proliferation and infection in the lungs, patients who experience aspiration of gastric contents into their lungs have an onset of pneumonitis, which is an inflammation of the lungs. And this leads rapidly to fever and increased respiratory rates, and often an infiltrated chest x-ray. It is only after 1 or 2 days of this finding persisting in patients who you suspect just aspirated that you truly can say that they likely have an pneumonia, an infection, and not just a lung irritation, a result of aspiration. The predominant organisms found in patients with aspiration pneumonia include anaerobic bacteria, as well as gram-negative organisms. Although the most common organisms recovered do still have to be gram-negatives and Staph aureus. And most of the time, this type of pneumonia affects the lower lobe of the right lung. This is due to the anatomy of the bronchi because the right main stem bronchus and the bronchus leading to the right lower lobe has the steepest slope, and so it is easiest for the bacteria to enter there. So if you see a patient who has sudden onset of cough and fever after vomiting and the chest x-ray shows an infiltrate in the right lower lobe, you should suspect aspiration pneumonia. Aspiration pneumonia is commonly seen in those who abuse alcohol and in very debilitated older patients. Risk factors include dysphagia, patients who are bedbound, patients who have neuromuscular disease, such as a recent stroke, who have difficulty swallowing, or multiple sclerosis, those with impaired consciousness, so patients who are in a coma, those who, for whatever ability, have a decreased ability to cough, and those with very poor dentition. If the aspiration occurs in the hospital, so the patient vomits or becomes unconscious and then suddenly develops tachypnea and fever in the hospital, you should consider specifically gram-negative organisms like Pseudomonas and Enterobacter.